Hey everybody, this is John from Texas Cryoworks. Hope everyone's having a great summer so far. Just wanted to share some exciting news with you. As you know, one of our goals has always been to have the absolute best equipment, cutting edge equipment, and equipment that works and that is healthy. So with that, we have just recently added our Aspen laser to our repertoire. And here with me is Dr. Tom Robertson. And Tom, he has extensive knowledge in laser therapy. He has worked with Kansas City Chiefs, St. Louis Blues, Detroit Pistons, and he was actually on staff with University of Missouri athletic department for a number of years. And he is an absolute guru in the laser world and for a world-class laser company. So I'm going to let Tom kind of talk about laser therapy, the future, where healthcare, he works all over the country, so kind of where it's headed, what he sees, and really talk about some benefits of laser therapy. We've only had it for a few days. We've been training, and we've seen some amazing results. I'm just pretty blown away by it all. But anyway, so with no further ado, this is Dr. Tom Robertson.
Thank you very much, John. Well, today I'm here to talk to you about laser therapy, or another word for it is photobiomodulation. At Aspen, we have lasers that go from 15 watts all the way up to 60 watts. And we have smaller ones and larger ones for all different types of facilities. With class 4 lasers, they treat pain and inflammation, and they treat it immediately. Laser therapy is progressive and accumulative, and it should get better at each visit and hold longer. The benefits are it's a very, very healthy way to get well from injuries. Most pro teams will have a couple, 2 or 3 lasers, and all, at least Division I teams in at least football and basketball have got lasers to expedite the healing process. Most veterinary medicine clinics nationwide, which I do visit, also have these, and they use them before and after their surgery problems, and which is a nice time to do it because the patient is immobile and they can get in and get out and not have to worry about the animal moving around. Laser therapy is very, very prevalent, and it's very popular, and it can be used in conjunction with many other types of modalities to treat chronic and acute pain. You will be hearing more and more about it in the years to come because it is so fast, safe, and efficient.
Thanks, Tom. What type of indications would we use laser therapy for?
In most places, you're going to have somebody coming in that would have an elbow pain, shoulder pain, anything where there's inflammation causing them restriction in movement. Headaches can be done. They could have an accident, sprain their ankle, bruising, anything that is causing an impairment that changes the response in their body. What's really interesting with laser therapy, the body responds usually very, very quickly. And with the human body, when it responds, if it's an active cell in the body and it's not inflamed, the body just ignores the class 4 stimulation of the laser. However, if it's an inflamed cell, which is what you want in photobiomodulation, it will actually excite the brain of the cell, the mitochondria, and it will start producing ATP, causing the cell to heal from the inside out. This is the goal of pain therapy, is to get that cell so that it has enough ATP to remain healthy. If you can maintain this buildup in that area, you will have a patient, athlete, whatever, that is pain-free. It's harder to do than it is to say, so it takes a little practice doing it, but your patients will love it because it feels good. As it's being applied, it feels like gentle, warm air being blown over the area, and they don't realize until a little bit afterwards that it's not only their range of motion that has been improved when you relieve the surface inflammation that is causing them to hurt and be bound up, But then as it goes deeper into the tissue, and our lasers go from 3 to 4 inches down through bone and into the cells that are affected.
Cool. I had a couple of questions. Does it work great on back pain? Because we see a lot of back pain.
It works very well on back pain, and as again, if I'm not being repetitive, but I am, is that it works very fast. You must put the photons of energy into the area, and usually I recommend for 4 by 6 inches in one area and penetrate that area, saturating it, so that this photonic energy starts at the skin and goes down deep into the tissue. And it can take several sessions for this to get into the area and then hold better and last longer, which is what you want. Most people will get better after one session, but you want to get it so that it holds better and lasts longer so they can get the relief. That's why in most clinics, after they get the pain contained and eliminated, then they do the exercise to make this area stronger so that the pain does not come back, which is the end result of getting rid of the pain.
Great. I have one final question. So there are different classifications of lasers out there, all the way from class 1, cold laser, all the way to class 4. And there's 1, 2, and 3. Those are all low-level light treatments or light therapies. They're considered to be cold lasers. Can you tell me the difference between a class 2 or 3 laser versus a class 4 laser?
Well, the major difference is going to be speed of the treatment, the amount of joules or energy that's put in the tissue. Obviously, class 4 is the one we've got, and our lasers are from 15 watts of power to 60 watts of power. Most 3B lasers, which is the category right below ours, they are 1 watt or less, and they will put in from, say, 5 to 20 joules to 60 joules a minute. This one, the ones we have, will put in from 600 a minute up to 3,600 a minute.
Wow.
And it makes the treatment faster, getting down deep into the tissue. And in some cases, I really believe, although the studies haven't been done yet, I believe certain conditions respond quickly better to with this heat, which you feel on the surface of the skin with class 4 lasers. That's why that heat that is felt, the laser head must be moved, and when the higher the wattage, the faster the movement for the laser, so that the patient remains comfortable during the entire treatment.
Great, Tom.
Okay.
I appreciate your time.
Thank you very much, John.
Thank you. Yep. Okay, so with that said, this entire next week, if anybody wants to come in and try the laser, in conjunction with spot cryo or cryo, or even just standalone laser sessions, guys, we're going to offer them for free. There's no way you can understand how good it is unless you come and do it yourself. It's kind of like our PMF equipment. I can talk great about it all day, but unless you try it, you just don't know. So I'm inviting everybody to come next week. Try it out for yourself for free. Come see us, come say hi. So with that, there's something else I'd like to talk about. So, as we kind of move forward, like I said earlier, we always strive to bring in the absolute best technology available. And as our business has evolved, thanks to all of you over the last 3 years. We've grown by leaps and bounds. We've been able to reinvest in the company and kind of shift gears and go in a different direction. So with that said, I'm happy to announce that in September we are actually adding a restorative rehabilitation program here at Texas Cryoworks. What does that mean? Basically, we're bringing in a team of occupational therapists, and I'm going to introduce you to Shannon here momentarily, but I'm going to let her talk about what they do. But the reason I'm doing this, so back in October, a lot of you know I had a little bit of a health scare, and little. And anyway, really ran through the ringer on seeing how the whole system works between insurance and clinics, and really just left a really bad taste in my mouth. You would not believe how bad the system is broken. And I felt like with the skill set that these particular OTs bring to the table, combined with our technology, we're going to be able to offer therapy and rehabilitative therapies. You would be hard pressed to find, I feel like, the combination of the skill set and technology. I think you're going to be hard pressed to find anything comparable to that in a pretty large area. So anyway, with no further ado, I'm going to introduce you to Shannon. So Shannon she is managing the therapy program that we're going to be implementing. And I'll shut up now and I'll just let you talk.
Hi, I'm Shannon Owens. I'm going to be managing and directing the rehabilitation team here at Texas Cryoworks. I'm so excited to be able to do this. When John approached me, we've been friends for over 30 years. And when he approached me, I just knew this was the perfect opportunity to bring something new and exciting to this area. So occupational therapy is what we do. There's all kinds of rehab, but we do occupational therapy. We have a team of 3 occupational therapy practitioners. Myself, I have over 10 years of experience in lots of different areas. Orthopedics being one, and concussions, an area that we're going to kind of focus on. Our occupational therapist that's going to be doing the evaluations has over 40 years in the field. There's not an area that she has not worked in. And then we also have Taylor Thedford. She's going to be joining us. She's been in the field for a few years, and she's had a lot of experience in different areas. So we're really excited to have this wonderful team come together and work to help the residents in the area. So occupational therapy is a rehabilitation. We focus on holistic healing. So we look at our patients from every area, body, mind, and spirit. With that being said, this works perfect with what John does here at Texas Cryoworks. And we're looking at the whole person, the whole patient, and so we're kind of addressing you from lots of different areas. In occupational therapy, occupational, what does that mean? Most people think it's getting you a job. It's not, but we can help you with that. Our occupations in our life are the things that we have to do, we need to do, or we want to do. So it's anything from self-care to gardening. And when you have an injury or you have a disability or you have pain in any area of your body and you're not able to do those occupations that you want to do, it causes you all kinds of problems. So that's what we're here to do. We're going to be seeing patients post-op, anything from shoulders to hips to knees. We're going to be seeing people with acute and chronic health conditions, anything from neurological disorders, Parkinson's, post-stroke, post-cancer treatment, and then we're going to be looking at concussions. So we're really, really excited to be able to bring this to the area.
We're very excited. Again, we're hoping to launch at the beginning of September. And the whole idea is to, and those of you that have been here, you know the environment we're in. And that's what we're trying to create with the therapy services. It's not a big, cookie cutter clinic. It's very intimate, it's very private therapy sessions that are very hands-on and very thorough, because our goal is to get you well.
So what we're going to do in those treatments, we're going to work with you to develop an individualized treatment that is not limited by the healthcare system or by insurance. So if you need to be seen 3 or 4 times a week, we're going to order that. And if that's something that you need and want to do, we're going to do it. We're going to be able to get you in here. We're going to use all of the state-of-the-art equipment that John has here, especially this new laser. We're super excited because it reduces pain and inflammation. We're able to make our therapy sessions so much more effective, and we can have much increased and quicker healing and getting you back to doing the activities that you want to do. So we're just super excited, and we can't wait to see you.
All right, y'all. So that's it. We had 2 big announcements: laser and therapy. anyway, so that's it, guys. Y'all have a great weekend. Y'all come see us next week, and so we can continue our our laser sessions. They're free all next week, and we'll get you feeling right. But anyway, have a great weekend. Bye.
Bye.